Hi, I'm Dr. Ram Chidambaram, Director of Institute of Shoulder, Elbow, Hand and Sports Injuries at MGM Healthcare. Let us talk about elbow dislocation. Elbow dislocation is a common injury, and elbow joint is the second most common joint to dislocate after shoulder. The common practice for elbow dislocation is to reduce the elbow and put in plaster or splint support and mobilization. Not all dislocations of elbow are simple. Some dislocations are really complex. So what are these complex fracture dislocations? Let us look at one form of injury called terrible triad. Here you see the bone model where you see the distal humerus and the radial head and the upper end of the ulnar bone, making that articulation supported by ligaments on either side here. In this rotatory injury, what happens? This ligament gets torn and the radial head gets broken and the entire elbow dislocates to the back by hitting again the bone buttressing here, which is called coronoid. So the combination of radial head fracture, ligament tear and coronoid fracture with dislocation is called terrible triad injury. The common practice is to remove the broken radial head fragment and not to address the ligament tear, and also the coronoid fracture is often neglected because of the complexity of the fracture. That's why it leads to a terrible outcome in terms of pain, stiffness of the elbow. That is why it was called terrible triad of the elbow. It is no longer terrible. As a specialist elbow surgeon with over 2 decades of experience and training in UK and Mayo Clinic USA, what we offer is a complete solution to the problem. We reassemble the broken radial head fragments and fix it using a mini headless compression screw or a pre-contoured anatomical radial head plating system. In a situation where this is beyond reconstruction, too much fragmented, we resort to radial head prosthetic replacement, where we replace the radial head with a titanium prosthesis. The coronoid fracture is always addressed using a mini screw or plating system. We repair the torn ligament on the outside and if necessary inside as well, using a triple loaded suture anchor system. This restores the stability of the elbow. The patient can start movement of the elbow from day 2 postoperative and they typically achieve a near full range movement in 4 to 6 weeks of time. If you neglect your elbow dislocation or have inappropriate treatment, you could end up having a painful stiff elbow, and the management of that would be challenging. So, elbow dislocation, get it right at the first time.